representatives.
Miami as well. Well, plenty of Capitol Hill maneuvering on health care ahead of the president's major speech tomorrow.
Let's get a look at the situation from a lawmaker's perspective. Joining us now, Republican Representative Dan Burton from Indiana. Welcome, Representative Burton. Thank you for being here.
Hi, Liz and David. Good seeing you.
Let's get to the breaking news, and that is from Senator Harry Reid and Representative Nancy Pelosi. You probably heard what they had to say, but if you didn't, pushing the public option issue here. What do you think? Is there a chance that the president will say anything tomorrow night where you could possibly embrace this and get something together?
Well, if he supports the public option, I don't believe you'll have any Republicans voting for it because they don't want the government controlling health care, and they don't want the government coming between a patient and the doctor, and they certainly don't want the rationing of health care, which that would lead to. So if it has the public option in it, you won't get many Republicans, if any.
All right. Well, what about this Republican play? It was Olympia Snowe, who was a Republican from Maine, for a trigger. That is, by some standard, some benchmark, if insurers don't come up with reduced costs or whatever, there will be a public option by some kind of trigger mechanism. Do you know anything about that, the latest?
Well, I've heard about that, but you have the same problem. If there's a trigger and the government can force that trigger through subsidizing or whatever happens to take place, then you're going to have the public option. The trigger is just another way of postponing it, but if you trigger it, you're going to have the public option, and I don't think the American people really want that. I certainly know the seniors don't.
Well, here's what I'm quite sure nobody wants, and that is for what we've seen in the past, and that is where insurance companies, look, you talk about rationing, trust me, insurance companies have rationed in the past. They've decided what they will and what they won't pay for. So if you add the public option and at least have it as a choice, what bothers you about it? Are you most worried that employers would turn around and say, well, this is cheaper, let's go with that instead?
If you have the public option, you're going to have the government involved in setting the rates and the costs, and they can lower the rates through subsidizing and force the employers to shift their employees from the private sector into the government sector. And so what you're going to have is a real erosion very quickly from the private sector into the government sector if you have any kind of a public option or if you have a triggering mechanism. Once that happens, you have a complete government takeover of health care.
Well, Congressman, the thing that I think everybody agrees on is that there are too many middlemen in health care. That is, the closer the patient gets to the health care provider, the more the patient will be concerned about cost and quality, and that should bring the cost down and the quality up. How do we remove the middlemen, whether they're insurers, Medicaid, Medicare, or this public option?
The bills we're supporting, David, include going across state lines to put more competition into the purchasing of health care. Some states have much higher health care rates than others. And if you go across state lines, you can erase that. Also, there ought to be things put into the mix like medical savings accounts, where you give the employee so much money that's tax-free, and the employer is tax-free as well in what he puts into it. And that's the employee's money, and they don't use it unless they absolutely it's necessary. And then you buy a major medical policy above that. If you went to a medical savings account system, that would help. If you reduced or removed the problem that doctors have with lawsuits, if you had tort reform, there's a number of things that would force the cost of health care down, and it would be much more competitive. And then, of course, the things that we want to put in there is the ability for people to take their health care with them wherever they go, and if there's a pre-existing condition, that they can still get health care. Now, you're going to have about 10 million people or 12 or 15 million people that will still be uninsured or uninsurable. Those people we're going to have to provide a safety net for.
Well, we look forward to watching to see how this develops. Thank you, Representative Dan Burton. We appreciate it. Now let's get a Democrat's take on the health care debate.